The truth is, we're seeing more and more diagnoses of type 2 diabetes in this country, and that diagnosis carries with it a lifetime of complications. And so we're hoping this morning to offer you some hope and some healing. We're so happy to welcome Dr. John Gwin, who is the medical director of the Wound Healing Center at CHI Memorial Hospital. Good to have you this morning.
Well, it's good to be here.
And the truth is, if we have time, we're going to focus on 3 different sets of people who this Wound Healing Center can help. But we want to begin with diabetes because it seems to be the fastest growing segment that you're seeing patients come to you for. So it all begins in diabetes with the foot, right? Your feet are very susceptible.
The feet are very important for a lot of reasons, which some of it has to do with the fact that many people with diabetes get an injury to the nerves where the nerves do not work right, and so it's what we call a neuropathy. So they cannot feel normally with their feet, so they're more susceptible to getting injuries.
So when someone is diagnosed with a diabetes diagnosis, they learn early on, you said, to check their feet regularly. But sadly, a wound can happen and it just doesn't heal.
That's correct. And once a wound starts in the diabetic patient, the healing process is often blunted because of the fact that the normal processes don't work right, and sometimes the blood flow is not normal.
So let's talk about the Wound Healing Center. You have there a bariatric chamber that you can use for patients if nothing else is working.
That's right. So we always start with a comprehensive look at patients from the standpoint of from their blood glucose control to whether there's infection, blood supply, what we call offloading, or whether the shoes are appropriate. And we treat wounds for all those issues. But then if they don't heal properly within about 4 weeks, then we consider the use of other treatments like the hyperbaric chamber.
This is an intense treatment. You were telling me that a patient will go into this chamber for 2 hours daily.
That's correct. So it does require going in for at least about 2 hours every day to be maintained at the pressure, which is about 2 times atmospheric pressure, with a high level of oxygen. And that's done daily for 4 to 6 weeks in many cases.
Let's kind of dispel some fears. It is not the same as an MRI in that while you're in there, though you can see it's not very large, you are free to kind of turn if you need to, and there's a movie you can watch.
Right, yeah. People often bring their own movies to watch. There is movement within that, and it's a clear chamber so that you can see out and communicate with the staff in the treatment center.
The daily treatments run on average 4 to 6 weeks?
Often we do. We usually start with about 4 weeks and then assess the response, and then sometimes we'll continue that up to about 6 weeks. That's correct.
At the end of that time, the objective is to heal the wound totally.
Right.
And then to prevent new ones from coming about.
Well, that's right. So our approach is to heal that wound and maintain a foot, you know, that's useful, that can be walked on without pain and problems, and again, we work towards preventing future ulcers as well.
You can self-refer.
Yes, that's correct.
Although you can always ask your doctor to make you a recommendation. Do you have any idea how long it typically takes to get an appointment?
Well, we like to get people in within 1 to 2 weeks.
That's good.
Yes.
That's pretty rapid.
Yeah, and if there are really more urgent things, we have opportunities to do that, to bring them in.
It's also interesting, I think, that it's not specific to the diabetes patient. You said this is also good for people who've had radiation treatment.
That's right. People who have wounds that after treatment for cancers of various types with radiation often have difficulty healing, and that's one of the circumstances in which the hyperbaric treatment has been really shown to be effective.
And then you call this a specific type of pressure wound, but for the layman out there, we're talking about bed sores. So for the elderly who are immobile, your body pays a price for that.
Well, it does, and we do see a lot of those patients. Most of them are not really candidates for this hyperbaric treatment, but we do have a comprehensive approach to treating those, which can be very successful.
Does it all begin with a phone call? Does someone call the center and kind of explain what you're facing? And then from there you say, come see us, or let me send you somewhere else? Right,
yes. When people call either the referring physician or the patient themselves, we gather the information about what the problem is, make sure it's appropriate for us to see, and then the appointment is scheduled.
You are seeing, back to the diabetic side, you are seeing kids diagnosed at younger ages. So is there an age limit on how young or how old you can be to use this chamber?
Well, we only treat adults. I mean, there's not much information on treating younger folks with that.
So
and we're oriented
21 and up,
population.
basically 18 and up.
Yeah. 18 and up, yeah.
And again, just stress for anybody watching, the hope is that you won't have to find them at the center, because you don't want to see a wound get that bad.
Yeah, we'd like to prevent these things if at all possible.
Well, you can find him. Dr. John Gwin is the medical director there. There's a large staff ready to help you at CHI Memorial. It is the Wound Healing Center. You can give him a call at 495-HEAL. That's 4325. Thank you, Dr. Gwin.
Thank you.
We're back after this.